Allergies, itchy eyes or skin, cold or sore throat, tummy trouble, aches and pains? Think pharmacy first. Your local pharmacy is your expert NHS health team treating a wide range of common illnesses and health concerns with no need to visit your GP. Remember, always keep a well-stocked medicine cabinet and order repeat prescriptions in plenty of time. Find your local pharmacy at nhs.uk/find-a-pharmacy. NHS, here to help.
This is the North East and North Cumbria Providers Podcast, highlighting the fantastic work taking place across the region to provide the highest quality of care.
Hi and welcome to another episode of the Providers Podcast. I'm your host Harry Newhouse and I'm the communications support for the North East and North Cumbria Provider Collaborative. On today's episode, we'll be discussing the new Medicines Manufacturing Centre that is currently being built in Seaton Delaval. Here to discuss this with me is the Centre's Head of Production, Kyle Winn, and Head of Quality, Laura Davies. Welcome to the podcast, Kyle and Laura.
Thanks, Harry.
Thank you.
Kyle, we'll start with you. Can you tell us a bit about yourself and your career within the NHS?
Yeah, of course, mate. So I'm Kyle Winn. So I, as Harry said, am Head of Production for the North East and North Cumbria Medicines Manufacturing Centre. Before this post, I've held senior positions within Northumbria Healthcare Foundation Trust within their licensed aseptic facility, and recently also became professional lead for England with the Association of Pharmacy Technicians.
And same question for you, Laura.
Hi, I'm Laura Davies and I'm Head of Quality for the Medicines Manufacturing Centre. My background's in chemistry, doing an undergraduate degree and PhD at Newcastle University. Following this, I had positions in industry and then came into the NHS and trained as a clinical scientist in pharmaceutical sciences with Newcastle NHS Trust. From here, I took up a position as Quality Assurance Manager to set up a new facility with Newcastle University to create a pet radiopharmacy facility. During this time, I also was supported by my colleagues to become a QP, qualified person, for the certification and release of manufactured clinical trial medicines. I'm now thrilled to take up this new position with the Medicines Manufacturing Centre.
Brilliant, thanks Laura.
Thank you.
We're here today to talk about the new Medicines Manufacturing Centre. Please can you tell me what this is?
Yeah, of course. So we are at Seaton Delaval today, where Northumbria Healthcare own the Manufacturing and Innovations Hub. So we're going to basically create a facility that will manufacture a number of products. And these are ready-to-administer products that will be used at ward level. So there's the number of products that we're going to manufacture. So we're going to manufacture systemic anti-cancer treatments, and we're going to do around 90,000 of those. And it just means that the amazing work that the spokes within our region, the North East and North Cumbria, are able to do those highly complex and bespoke products that they currently do. We are just going to support them with some ready-to-administer drugs that they don't have to do. We're also going to do ready-to-administer antibiotics and diuretics, so we're going to manufacture around 750,000 units of those. And the idea is that it will save nursing time on the wards within the North East and North Cumbria, and this time saved will be reinvested into patient care, so carrying out a discharge, carrying out some patients' medication reviews and things like that. And actually in the North East and North Cumbria alone, we will be saving 2,764 hours per week of nursing time that will be reinvested in these patient experiences. And that's the equivalent of 77 whole-time equivalent nurses, to put it into perspective. That will be extra time within the region. So we're also going to do around 500,000 over-labelled medicines. These are licensed packs of medicines where I have a label which is pre-printed with directions on so that a nurse can use them at ward level under PGDs, and it basically improves flow throughout the hospitals and gives the patients a better experience when they're in the hospitals as well, because we all know patients would like to go home as soon as possible. These products enable that. And actually, we're going to have a brand new workforce of 150 new roles as well, which is really exciting. The project itself is part of the hub and spoke model, which is an NHS England incentive, which is part of the Infusions and Specialist Medicines Board. So there's quite a lot of benefits of creating in hubs. Firstly, it improves patient care because of the nursing time saved at ward level is reinvested back into spending time with the patients. It improves the product quality. Products that are made within our state-of-the-art isolators and state-of-the-art facility will be of a higher quality than of that made on ward station, for example. There'll also be an increased workforce in technical services. Technical services, for anyone that doesn't know in pharmacy, is kind of like the Cinderella of our world, obviously behind the scenes. doing amazing work but not often seen. So creating some new roles within that workforce is really exciting, both locally and both nationally. We're here to support the spokes. The spokes do an amazing job on what they do in supplying chemotherapy to patients. We are here to support them. And also to support the commercial compounders. Trusts at the minute buy in quite a lot of products from external compounders, and we're not looking to replace those compounders, we're looking to support them. So there is a robust supply chain for systemic anti-cancer treatments in the future. And I thought I like to do a little bit of myth busting, because you always hear a little bit of rumours on terms of what the hubs are going to do. So I just kind of want to make it clear. We're not replacing the need for existing facilities. There will still be aseptic spokes throughout the North East and North Cumbria. And we're not replacing the commercial compounders. There's definitely a need still to work with those third parties. And we're not replacing nurses. The idea is that we're giving nurses more time to spend with patients. So if it was my friends or family, I would far rather the nurses have spent time with them at bedside than be stuck in a treatment room preparing an antibiotic, for example. So yeah, we're developing the hubs to support. That's, I think, the key message in this. We are here to support the network for the good of the patients.
To make it the aseptic medicine, what's actually needed to be put in the Medicines Manufacturing Centre?
Yep, so the MMC will be made up of 4 clean rooms essentially, and within those clean rooms there'll be state-of-the-art vaporised hydrogen peroxide gassing isolators. Basically the box in which the isolator sits is a sterile environment, so there's no contamination. So a lot of the patients who typically have our products are immunocompromised. So if there's anything within the products, it might get straight into their immune system. So the idea is that we're doing it in a sterile environment so that we're not impacting the health of the patient negatively. So it's in sterile environments. I think that's a key word to put out there. This is a sterile facility. We're making sterile aseptic medicines. So those 4 clean rooms will have supportive areas, whether that be we do visual inspection or we do transfer disinfection. And then there's other areas of the facility. We've got a warehouse space with 2 large cold rooms for goods in and goods out. There's a QC lab, so a quality control lab for microbiology, and also wet chemistry as well, so analytical chemistry such as stability studies. As Laura said, we've got a training facility within that. We have a large office space. We've got a welfare area for staff, because it's important that staff have a little bit of downtime as well. We need to look after our staff in that respect as well. So yeah, it's all about making these medicines in these sterile clean rooms. Imagine our staff wearing very clean room garments with a hairnet, no hair showing, gloves. I kind of use it as an analogy sometimes when you see people on CSI or those sort of programs where they're putting their hands in these gauntlets into a chemistry lab. It's basically an isolator is a big version of that, and it's just a big barrier system to protect the product and also protect our staff as well in the processes.
Thank you very much. As you mentioned there, NHS England are part of the whole plans of the Medicines Manufacturing Centre.
Yeah.
What's the significance of the one in Seaton Delaval that's being built?
Yeah, so ours is the largest of the 5 Pathfinder sites. So basically there was a pot of money that came on the back of the transformation report, and the North East and North Cumbria were afforded 29.7 million for our facility up in the North East. So really exciting, very grateful for the opportunity to be able to do this in our region. There's another 5 sites within the UK, and that is Leeds, Manchester, Hampshire, Isle of Wight have got one, and Devon and Plymouth are doing it as a combination as well. So each of our sites are doing something a little bit different. So the idea is that we are creating the blueprint for future NHS facilities. They can kind of copy what we've done, learn from it, and actually make it a little bit better. So that there is this massive network of hub and spokes delivering patient care.
So there's benefits to the local economy. We're going to recruit and train a specialist aseptic medicines service workforce, creating up to 150 jobs. This will secure a highly skilled workforce pipeline to capitalise on the talent in the available local population. We're bringing back into use a vacant industrial building and delivering jobs in the area where previously there's been loss of employment due to closure of larger employers. The medicines being manufactured at the MNC themselves will reduce costs through economies of scale and improving resilience. There'll be unwarranted variation in service delivery and presentation of the aseptic medicines through improving safety of medicines for our patients.
What's the latest in regards of where we're up to with plans for the new regional facility here in the North East and North Cumbria?
So we're at a very exciting phase in the project. We have recently had the full business case for the project approved, and therefore we can start developing the MMC for the region. The MMC facility is in the latest design phases with a local contractor, Merit. Merit utilises modular builds in which a significant portion of the build is completed off-site in their factory, which can accelerate build timescales. Building on the site here in Seaton Delaval will commence in November this year with the aim of completion in autumn 2025. In addition to the facility design and build, we are starting to establish what manufacturing and quality control equipment we need for the new facility. We are working with Gettner to design and produce a number of manufacturing isolators, and we are also starting to grow our workforce with the appointment of new staff in the near future.
Yeah, it's a really exciting time. I'm really excited to start to see spades in the ground in November, as they say. And as Laura said, we're already growing that workforce, and actually we've got production manager rollout and Laura's deputy head of quality out.
When do you plan on the sort of first medicines being released to our regional hospitals?
Yep, so we're aiming to have the build completed, as Laura said, within her timescales at autumn 2025, with an aim to be manufacturing the first half of 2026, really, subject to gaining our manufacturer specials license from the MHRA, which is the UK's medicines regulatory authority. So once the build is complete in 2025, there'll probably be a significant period of qualification of the equipment and the processes, some intense staff training, and basically where we set up a new pharmaceutical quality system to ensure that the supply of the medicines is to the highest of quality.
You mentioned earlier in the podcast some of the benefits for our patients, but on a regional aspect for patients in the North East and North Cumbria, how will this significantly benefit them?
Yeah, so I think in my earlier point, I kind of touched on the benefits that patients within hospitals would get from these, but actually the transformation report focused a lot on delivering care closer to patients' homes. So geographically, we live in a very rural area. And actually, can we deliver some of these treatments closer to patients' homes so they don't have to spend time in a hospital away from their friends and family where they might live 20, 30, 40 miles away? And it's quite hard for their families to come and see them. So actually, could we put these antibiotics in an elastomeric device that the patient has at home? Or a nurse that goes into a patient's house might have to go 3 times a day for a typical antibiotic. Can we do something novel and actually deliver care closer to a patient's home? So that's another benefit of it. But yeah, for me, it's this, the whole benefit is having a robust supply chain of chemotherapy ready there for chemotherapy patients, so we can kind of address those backlogs within the whole NHS. And the ready to administer products, very passionate about them as well, because again, I'd far rather see nurses who are doing a fantastic job at ward level, giving them the chance to be able to impact patients instead of being essentially stuck in a treatment room preparing medicines, where we, from behind the scenes, are specialists in what we do. We can help them deliver the best care for patients, which they are specialists in what they do. So it's kind of like a team effort. We are just part of the wider NHS team trying to deliver better patient care for our patients within the North East and North Cumbria.
And you mentioned that it also benefits staff as well.
Yeah, definitely.
So it's not just for patients that the MMC will be benefiting.
Well, yeah, because as Laura alluded to in one of her points, we've got 150 new staff. These staff are going to be trained. These are some highly trained people, but actually we want to create this culture, and we want to create an organogram and a pathway where someone can come in with their entry-level grades, and actually we can put some educational pathways in front of them, and if they want to, they should be able to reach the production manager roles, head of production, head of quality, managing director, if they're wanting to put themselves through those educational pathways. So yeah, it's really exciting because I think it creates a lot of opportunities for people who almost don't want to be patient-facing. I was one of those people. I used to go red when I used to go talk to patients, which is why I kind of got into technical services, because you can help the patients from behind the scenes. And there's a lot of people who want to help patients and work for the NHS, but there's this perception that everyone has to be a doctor or nurse. It's very much not the case. I'm a pharmacy technician, Laura's a scientist. We don't have to be patient-facing to make a big impact on patient care. And I'm very passionate about trying to push that message forward a little bit. And we've even got, Harry, we've got a school coming on site in the next couple of days to try and look at the facility and see if we can inspire the next generation.
For the foundation trusts in our region that are part of the provider collaborative, you mentioned how it's going to benefit patients, how it's going to benefit staff. How is it going to benefit our foundation trust as a whole for this region?
I think it will help in the delivery of medicines for all our patients within all the trusts in the regions. It will put less strain on the smaller spoke manufacturing units within each of our foundation trusts and allow them to focus on production of smaller volume bespoke medicines with short shelf lives, which are still critical to our supply in the region for all our trusts and patients within them.
And you mentioned how there's going to be 150 new jobs set up. Some are already on NHS jobs.
Yeah.
How much of an impact will this be on recruitment within the North East and North Cumbria and eventually, obviously, the financial aspect in the region?
Yeah, I think it's amazing because I alluded that our service is kind of like a Cinderella of the pharmacy and pharmaceutical world within NHS. So I think putting 150 new jobs in the wider pool of skilled people, these are very skilled people who make chemotherapy, and actually putting that in the wider pool is a really amazing thing to be able to do.
And what sort of jobs will be available?
Yeah, so we'll be training people in clean room supervisors, production operators, we'll have warehouse staff, we'll have quality control scientists, people in quality assurance, and also highly other skilled areas, business, finance,
So
managing director, wide range there.
Domestics,
Yeah.
warehousing teams. Yeah, there's a very wide range of jobs, and it again gets back to that point. To work in the NHS, you don't have to be a doctor or nurse. There's a lot of roles for people to do to come and work for the NHS, and it is a really good place to work.
It is brilliant, and it's good. I think we're opening an opportunity where there can be a career progression as well. We've got entry-level roles all the way up to really senior roles, and we've got training pathways we'd like to put in place to allow people to grow into new roles.
You mentioned there that there'll be training available for staff interested in working in aseptics medicine. So we're not just thinking of the now, we're thinking of the future.
I think every grade that comes in, whether that be warehouse, whether that be the production operatives who are making these products within the isolators and the clean rooms, they will get training. But actually there's a lot of qualifications that staff can do to develop themselves and their profession. So again, I'm a pharmacy technician, so we will be training potentially pharmacy technicians, we'll be training science manufacturing technicians, and those staff can go on to do other qualifications, such as an MBA in business management, or me personally, I did a master's degree in pharmaceutical technology and quality assurance at Manchester University while I was employed at Northumbria Healthcare Foundation Trust. So there's a lot of different avenues there, and Laura came through a different avenue as well.
Yeah, I came through the scientific training program, which leads to a clinical scientist. So we specialise in the technical service industry in pharmaceutical sciences. So that's a 3-year program in which you do a master's course at Manchester University.
I think the other thing to put out there is that we are very much linking with the Infusions and Specials Medicines Board and their workforce stream. So actually we're trying to look at streamlining what workforce looks like in technical services to create a standard pathway for staff. It's really exciting that you can come in at these entry levels and hold these very senior roles within a period of time within your career. And it's very achievable as well, because I came in as a student who came in at 17, and through the educational pathways that are presented within technical services, I've been able to achieve something.
I think we're also excited in the MMC that we're also going to have dedicated trainers involved in the workforce plan that we've modelled. So hopefully we'll have people involved in training on a day-to-day basis. We're going to set up hopefully space within the facility to deliver that training on offline equipment and in training rooms as well, which I think will really support people in that development process.
Brilliant. Thank you, Carl and Laura, for taking the time out of your busy days and talking to me about the new flagship Medicines Manufacturing Centre. It all sounds very exciting.
Brilliant, thank you.
Thanks for having me, Harry. Thank you.
Thanks for joining us for this episode of the Providers Podcast. Hit subscribe to keep up to date with the latest news and catch up with what we've been up to on our website and social media pages.